Here are 5 things to know about returning to sexy time postpartum with a bonus tip at the end. Second to having your first bowel movement postpartum, one of the most daunting things for postpartum women is thinking about returning to sex for obvious and valid reasons. At your 6-week checkup, your OB will most likely say something like, "You are good to go for everything," and you're going to be thinking, "I most certainly am not good to go for everything." Know that the timeline for returning to sex is so individual and personal for all women. Most women that I see at week 7, 8, 9, 10 have not had sex yet, and it's not even on their mind. So let's just first normalize that. When you do decide that you're ready for sexy time, there are a number of things that you can do to make it a more comfortable and enjoyable experience for both you and your partner, because I can guarantee that if you're having a good time, they're going to be having a good time. Number 1, if you take nothing else away from this video, take this. Using your breath can significantly modulate your pain. When you go into a shallow and fast breathing pattern, you tap into what's called your sympathetic nervous system. This is your fight, flight, heart racing, blood pressure elevated, and most importantly, muscles guarding nervous system response. When you take slow, deep belly breaths, we tap into your parasympathetic nervous system, which is your rest, digest, calming, and most importantly, muscles relax nervous system. This is what you want to have happen when you're having sexy time. So be mindful of your breath and see if you can take those nice, slow, deep belly breaths, just like we talked about in our pelvic floor breathing video. I also want you to pay attention to where you're holding tension. Is your jaw clenched? Are your shoulders up to your ears? Are your toes curled under? Maybe when you're having an orgasm, that would be great. Not right at the start of sex. Number 2, foreplay. When we are aroused, our vagina lengthens and tilts back in preparation for penetration. If foreplay isn't happening or isn't good and you're not aroused, then that's not going to happen, and that can make sex more painful. If you're struggling to talk to your partner about why you can't just dive right into penetrative sex at the get-go, show them this video. Number 3, play with positions. If you're having pain in missionary, try placing a pillow or 2 underneath your hips to elevate your pelvis for a better position with penetration. Try laying on your side and hugging a pillow with your partner behind you. Get into whatever position is going to help you relax the most. You will return to doggy eventually, just not right now. But hey, if that's most comfortable for you, then by all means. Number 4, perineal massage. This is something that I teach my pregnant clients how to do. However, it can be so wonderful in this postpartum period. Wait until you are 6 weeks postpartum and have gotten the clear from your OB before performing this. This is something that you can do right before having sex or make it a part of your weekly routine. I like when people are doing this either in the bath or after a bath to help with muscle relaxation. You're going to get your thumb or your finger and insert your first knuckle in the vagina. Then you're going to slowly press either the left or the right. We're going to do both. So it doesn't matter where you start. Apply a good amount of pressure until you start to feel a bit of discomfort, maybe a 3 or 4 out of 10. And once you find that spot, maintain that pressure as you take nice, slow, deep breaths. And just think about that muscle just melting like butter under your finger. That pain should decrease after some time, maybe 90 seconds to 3 minutes. And after that, you're going to move diagonally down and do the same thing. Then we're going to go to 6 o'clock and then the other side diagonally down and then straight across to the other side. And after you hit all 5 of those spots, you're going to do some sweeping motions along the bottom entrance of the vagina. You're not going to hurt anything by doing this. Your vagina stretches a lot more with penetrative sex. Start by performing this 2 to 3 times per week and then drop down to 1 time a week as the pain continues to decrease. Number 5, safety versus danger messages. Your biggest sex organ is your brain. The things that you tell yourself and the messages in your brain can significantly affect your experience in the bedroom. If you're saying things to yourself like, "Okay, I know this is going to hurt, but I just have to get through it," or "This was painful last time and I expect it to be painful this time," things that I call danger messages, it's likely that your pelvic floor muscles are going to guard up and stay guarded, making sex either painful or just not enjoyable. Instead, can we trick your brain a bit by saying things like, "I'm so excited to do this. I love my partner, I'm comfortable in my bed, my body is ready to do this, things that I call safety messages. Even if you don't wholeheartedly believe it in the moment, say it anyways and take some deep breaths. Your thoughts and emotions drive your behavior. Hello, cognitive behavioral theory, but they also drive your pain response. So many of my clients have told me that just this one tip has significantly helped them. Try it and practice it repeatedly. Now my bonus tip, use lube. I typically recommend a silicone-based lube, as a water-based lube is going to absorb into your skin and get tackier a lot quicker. I like the brand Uberlube as they have minimal and clean ingredients. If you have not watched my video on pelvic floor stretches, make sure to do that next because those are key for pelvic floor relaxation. I hope you found this video helpful. Let me know if you have any questions and I will see you in the next one.